Medical aid in dying, often referred to as physician-assisted suicide, is one of the most controversial bills today. A look into why some Minnesotans are pushing to pass the Minnesota Compassionate Care Act, while others say the pending bill is dangerous and misleading. I'm Brenna Kamal. This is Our Issues, Twin Cities. After watching her mother suffer a painful death, Sally's promise to her began.
Oh, my mom was something else. My mom was 75 when she was diagnosed with leukemia, going on 40, I like to say. When my mother was ill, the first thing she did when she was diagnosed was figure out treatment options. Chemotherapy, blood transfusions, all the things that she could choose from to try to make her life as good of a quality of life as for the time she had left. But after that, and she started on blood transfusions and just tried to live her life instead of worry about her death.
Sally's mother started to question how she was going to die and what her end was going to be like.
Often, leukemia patients, their quality of life depreciates so much towards the end that they just choose to stop having blood transfusions because it's just getting to be too much. So unfortunately, that's pretty common, and what happens then is you bleed to death after a couple of days of no transfusions or a couple weeks, depending on where you're at, and you bleed to death through every orifice of your body. Try and think about that every day. And so it was really bothersome to her, and she's like, I need to find another way to do this. There's got to be some more peaceful way, less painful way, less traumatic way for me to die. And as we were exploring all of this, the story of Brittany Menard in California was on the front of the People magazine in the oncology clinic.
It was in 2014 when 29-year-old terminally ill Brittany Menard shook the nation when she moved to Oregon to access its Death with Dignity law and end her life with medication.
Well, my mother was like, well, we have to do this. Well, you have to establish residency, it's like 6-month process, you have to get new doctors, you have to find doctors that are willing to help you, and leave behind what she had, 14 grandchildren, and all of us. Well, you don't want to leave your whole family behind at the end of your life. So she realized that this was just not possible for her.
Before she passed, Sally vowed to her dying mother she would fight for others in Minnesota who choose to die in dignity.
We need to let people make their own decisions.
In 2015, Senator Chris Eaton first introduced the Minnesota Compassionate Care Act, which would grant terminally ill Minnesota adults with less than 6 months to live to receive lethal prescriptions from their doctors, allowing them to die peaceful instead of the natural progression of a disease. Why is this legislation so important for the state of Minnesota?
I think that we haven't had the conversation about dying. I mean, nobody gets out of this life alive. We're all terminal at some point, and but nobody talks about it. We've kind of sterilized the whole process. I think that as more people are taking care of their parents at home, it's become more front and center. I think it's a patient's rights issue. You have the right to refuse treatment. You have the right to refuse a medication. You have the right to stop eating and drinking. But for some reason we insist that people keep going, no matter how much pain or misery they're in, till the very end. That nothing can interfere with that, and I just think that that's cruel.
I don't think anyone should have to be horrified and think of how bad the end of their life is going to be when they're already terminally ill. There's 2 parts to this. It's being able to end your suffering, but it's being able to know that when the time comes, it's available to you.
Under Eden's bill, 2 physicians must confirm that the patient meets the criteria. The patient would have to be mentally competent to make sound decisions, submit 2 written requests, each with 2 witnesses, and take the medications themselves.
Medical aid in dying applies to people who want more than anything to live, but a deadly disease is causing them extreme suffering at the end of their lives.
It was 20 years ago when Bobby was diagnosed with ALS. Through the assistance of her iPad, Bobby explains why she's in favor of the pending bill.
If I am competent enough to make personal choices about my health care, what plan to choose, what physician can give me the best treatment, what hospital can provide the best care, I should be allowed to make the decision not to die the suffocating, paralyzing death people who have ALS are destined to. It seems to me, the compassionate thing to do is allow people with a terminal disease to have the choice to leave this life with dignity, surrounded by loved ones.
Today, California, Washington, Oregon, and Vermont have physician aid in dying laws in place. In Montana and New Mexico, the practice is protected by court decisions. The Minnesota Compassionate Care Act is modeled after Oregon's Death with Dignity bill, which was passed nearly 20 years ago. The Minnesota Compassionate Care Act is modeled after Oregon's Death with Dignity bill. What are the main similarities and differences between the two bills?
Mine is a little more stringent as far as the checks and balances. The Oregon one has been in place almost 18 years now, and they've kind of lightened up on some of the paperwork and some of the steps that people have to go through. But mine is more where theirs started, I guess is what I would say. I am changing the name to the End of Life Options because I think that's more accurate. Because I think there's a myriad of ways that people can die with dignity, and that people should always have compassion at the end of life, and that it's not exclusively this. So this is an end-of-life option, and that's really how I'd like people to look at it. You have a lot of options at the end of your life. Like I said, you can stop eating and drinking. You can refuse treatment. This is another option. You can be given a medication that you take yourself if you're a competent and an adult to go to sleep peacefully.
When we return, why some locals oppose end-of-life medication. In an aging population where life expectancies are at its highest across the U.S., many people are questioning how to spare people a drawn-out and painful death, while others believe the notion of end-of-life medication is wrong.
That the bill won't accomplish what it says it will. It's not compassionate, and it's not care, and physician-assisted suicide is fundamentally different than care of the terminally ill.
Cardiologist Dr. Tom Nobrega is a critic of the proposed bill.
It's a medically prescribed intervention which hastens death or expedites death. It's explicitly prohibited by the Hippocratic Oath that lots of us look to for guidance. This creates a terrible conflict between the doctor as a healer, the doctor as a compassionate guide, and a conflict between the doctor then as someone who expedites death or hastens death. Now, I should emphasize we can estimate prognosis, we can tell people that their expected survival is limited, but that's about all that medical science allows us to say, really. The bill says or indicates that the patient ought to notify their next of kin, but there's no obligation in the bill that that take place. And so the next of kin may not know that their loved one or someone with whom they have lost contact is entertaining this as a possibility. Another way in which I think the bill as written obscures reality is it essentially provides that the doctor fill out the death certificate listing the underlying disease as the cause of death and obscuring the reality that the death was caused by a poison or a drug overdose.
Choice such as assisted suicide is really a choice against freedom. It's not really for freedom. And
Teresa Tawil is a nurse practitioner with experience in geriatrics.
people think of the instantaneous moment of it, but if you think in terms of the societal choice for assisted suicide, actually it takes away the liberty for people that are, sick and poor and marginalized. They're the ones that are going to be victims of this bill and are going to feel like they don't have a choice.
In terms of danger, some people express this as the right to die quickly becomes a duty to die. We live in an era of cost constraints. We live in an era that values efficiency. And patients are going to feel like, maybe I should save the money, maybe I should pass more on to my loved ones than I would otherwise. I think that is not something anybody wants. It's frankly a little heartbreaking to think that patients would feel devalued to the point that they might feel compelled or pressured to pursue this option.
Somebody on a disability that is not terminal doesn't have access to this medication. Someone who hasn't asked for it on their own with 2 separate physicians does not have access to this medication. So there are a lot of safeguards in place, and the Minnesota legislation is modeled after that with those same safeguards.
Another little bump, Kylan. There you go.
Although Kathy Jo's son is incompetent and does not qualify for the pending bill, she believes the Minnesota Compassionate Care Act is a disability rights issue.
Jerica Bolin in Appleton, Wisconsin, who's a young girl with disabilities. And you know what we do when she says she wants to kill herself? We applaud her. We call her courageous. We say, what a brave young girl, and we throw her a party for killing herself. One, we're upset, one, we're not. What is the only distinguishing characteristic? Disability, no disability. So that offends me.
She opposes physician-assisted suicide because of what it means for her 21-year-old son, Kylan, who is disabled. How would the Minnesota Compassionate Care Act affect your son and others who are disabled?
It would affect people with disabilities by the implication that they're better off dead than disabled. That if you lose some autonomy, if you need help using the bathroom or you use a diaper, that your life is less valuable and thus will help you commit suicide via a doctor's prescription. People with disabilities struggle to maintain autonomy, to have control over their lives. It's about controlling your bowel or bladder, which sort of is infuriating to me. My son's been diapered for 22 years and his life still has value, and I still love him and I still want him to be a part of his community. It's not a reason for us to go say, hey, you know, we'd like a prescription to kill ourselves now because we're diapered.
How have your patients solidified your opposing beliefs of the bill?
One of the things that I think all of us doctors see every day is when patients come in, they're vulnerable, they are, you might say they're scared. It's very hard for us to convey as fully as possible the burdens and the benefits of certain treatments. And I think one of the things, or several of the things that patients and their families hopefully will consider is that there's no obligation to implement a treatment that they find burdensome or even that they find terribly expensive. There's no obligation for a patient to accept the doctor's advice. Second thing is that people need to understand is that withdrawing care, backing off, or saying we're going to let nature take its course is a fundamentally different thing than saying that we're going to hasten death. I think most doctors are, you might say, comfortable with saying we're going to withdraw care because we no longer are providing the kind of benefit that we really want to provide for our patients. We have to acknowledge that medical science no longer has very much to offer this patient, but it doesn't mean that we abandon that patient to a death in this manner.
Why is palliative care a better option for the terminally ill?
The great hospice teams we have in the Twin Cities, there's so many different hospice teams that are, providing, limiting the suffering of patients. We really have great technology. There's no reason why anybody has to feel like they're going to be suffering or, kept alive, indefinitely, that kind of thing. It's just, I think it's one of those fear tactics that's just not reality.
But supporters of the controversial bill say it's a personal choice. Why do you think it's a personal choice?
I think it's patients' rights. I can direct my care all the way to that point, whether it's medication or treatments or surgeries, or I have the say, yes or no. But all of a sudden at the end of life, it's up to the doctor to decide what's best for you. I guess I think we've gone beyond that paternalistic approach to medicine, and it's time for people to make some serious decisions of their own.
Why on earth can't we die how we wish? I don't believe that anyone should have told my mother or me or anyone else that they have to suffer for the last several days of their life instead of just peacefully exiting.
Up next on Our Issues Twin Cities, a look into the future of the highly controversial bill. Hundreds attended the last hearing of the Minnesota Compassionate Care Act in March, drawing emotional testimonies from both proponents and opponents of the bill.
I will be filing this bill as the end-of-life options instead of the compassionate care. And I will be strongly lobbying to get a hearing in the Health and Human Services Policy Committee.
Do you think Minnesota will pass the bill?
I hope not, and I think that my patients aren't asking for this, my physician colleagues are not asking for this, so I don't perceive that Minnesota really wants this to happen. Minnesota has magnificent health care, great doctors, great systems, universities, training programs. There's really no reason for me anyway to send a patient out of Minnesota for care. If you need it, we can probably do it for you here.
If Minnesota does pass the bill, what does it mean for Minnesotans?
It means that there'll be a couple years of rulemaking and getting all of the pieces in place. And then after that, once it goes into effect, as it just did in California last June, people will have that option to go to their doctor and say, you know, if they're terminal, meaning they qualify for hospice, we use the same language, which is considered to unlikely you'd still be alive in 6 months. And if they're competent and an adult over 18, that they would be able to do the first step, which would be put in a written request for the medication. And then that doctor would decide if you qualified and refer you to a second doctor. And then the second doctor, if they also concurred, then they would send you back to your first doctor, who would you have to send a second written request to, and they would then not sooner than 15 days after the first written request, and then they would write the prescription and explain how the medication should be taken and how it will work and what to expect.
I don't think any doctor or nurse or care provider should feel compelled or coerced or threatened for not wanting to participate in this. I think that, in a sense, as I kind of said before, doctors don't really have a role in this. Doctors don't have a special knowledge about killing people or how to hasten their death. It is proscribed by the Hippocratic Oath, and so we don't. This is not something we train for. We're meant to be, again, healers and compassionate guides, even when our medical science can't do as much for patients as we wish it would.
In the 2015 Data Summary of Oregon's Death with Dignity Act, 40% of patients did not take their doctor-prescribed end-of-life medication. What does that say about those who prescribed that medication?
I think it says more about the people who asked for it. People take a great deal of comfort in knowing that if it gets too bad, I have this option. And apparently with 40%, that it didn't get that bad. They didn't need to use it. But it takes away a lot of the anxiety from people that the pain from cancer or whatever might get more than I can handle. And they're scared, and it takes away that fear.
Many of the people that get the medication don't take the medication. A great deal of why this is so important is the peace of mind it offers terminally ill patients, that they can continue their fight to live as well as they can, but when it's days or weeks of nothing left but misery, pain, and suffering, that they can choose to stop that with something as simple as oral medication. And so I think terminally ill patients deserve the right in Minnesota to end their suffering if they choose to, and to have the peace of mind to know that they have it available if they want it. I'm not even sure if my mother would have taken the medication. She wanted it in her nightstand so she could concentrate on living and fighting for her quality of life until it became no longer possible.
I don't think doctor-prescribed death is really what patients want. I think that substantial, significant percentage of patients was looking for a kind of comfort that we should be able to provide in a different way than a life-ending drug.
For now, the lines remain divided. Both those and against the bill will be ready to fight for their beliefs at the future hearing. What do you propose will happen at the next hearing?
What I would propose is that doctors and patients and our community as a whole be better informed about issues that surface around the end of life, and that we utilize our resources to, again, affirm the inherent dignity of all of our patients at every stage of life.
We're going to make our case. We are going to explain why this is so important. And this isn't important to millions of people. This is important to only a small fraction of people that are terminally ill that can't get relief any other way. And those people have this right.
Sally will continue advocating for her mother's dream.
She asked me to make this her legacy, basically, that I needed to get involved and do anything I could to make this happen. And I know she'd be proud. I know she'd be thrilled that this is coming. But I think she'd be stomping her feet saying, what's taking so long?
As for Kathy Jo, she will do the same for Kylan.
I am just going to keep going to legislators. I'm going to keep telling our story. I want people to see Kylan and view his life, how happy he is, how in the community he is.
For Bobby, the bill would give her peace of mind, knowing she has the option to make her own decisions about her end of life.
Knowing that I have the option of requesting the prescription from my physician, that I can fill or not fill the prescription, and that I can choose whether or not to take the medication. Peace of mind is essential when living with a terminal diagnosis.
Thank you for joining me this week on Our Issues Twin Cities. I'm Brenna Kaman. See you next time.